I know I've been on here before to talk about a range of topics, supporting couples and supporting love and supporting couples dealing with heartbreak after brain injury is actually the main focus of my work. And it's been something that I've kind of dedicated my career towards for the last 15 years or so, this specific topic, because I was aware that working in different rehabilitation centres, couples, either one or both partners had recognised a change in their romantic relationship, a change in the emotional connection and in the bond between partners as a core aspect of post-brain injury life. Yet that wasn't a thing that rehabilitation services focused on. It was almost as if the rehabilitation centres focused on the independence of the survivor, when a bigger need was interdependence, how people connect with other people, how the emotional bond can be strengthened, restored, or if not, if there was distance and conflict and things were irretrievable, things weren't able to go back as they were, how both partners were supported to cope with the heartbreak of that. The other thing I became aware of is that a romantic couple relationship after brain injury presented a big healthcare cost, in that there was the distress of both the survivor and the non-injured partner. And often the non-injured partner's heartbreak and distress wasn't being seen in the rehabilitation services. That might be seen in a conversation with a GP or doctor, leading to a prescription of antidepressants or something like this, as if it was a whole different disconnected world to the aspect of brain injury that led to something going horribly wrong. And I'm not going to mince my words on this. For many, many couples, things go horribly wrong as a function of the brain injury in their lives. The research that I was going to show you includes quotes from often female non-injured partners describing their relationship as broken or wrong. Survivors are described as living with Jekyll and Hyde. Something feels damaged. Research that I did, both the survivor and his partner said it's like a piece of grit in our hearts, wearing us both away from the inside. So distress, disconnection, distance are huge, uncommon experiences. And it often becomes more prevalent and more evident in kind of after the first year, definitely after the second year post-injury. 2 to 5 years is a big time post-injury where if there's couple support available, then the referrals are made. So it's kind of often after the survivor's made substantive physical gains and gains in their independent functioning, but the connection between them and their partner feels different or difficult. So we're recognizing that this wasn't even a conversation that was on the map for survivors and partners. In my last NHS service where I worked, the Community Head and Shoe Service in Aylesbury, we developed a couples therapy service. So I trained as a couples therapist alongside my training as a clinical neuropsychologist, and I began to see how couples therapy could be adapted to support the needs of survivors and their partners. So there is a science of love there is a science of brains in love. People have been studied in brain scanners looking at their loved one, be it a child or be it a partner. A mum and a baby have even been brain scanned having a cuddle. And the brain in love, this is where it's a shame I don't have the pictures to show you. The brain in love is a brain that lights up right in the center of the brain, whereas the thinking and reasoning and the more effortful part of the brain goes quiet. And we do need to hold other people in mind in a very deliberate way. We need to step in the shoes of other people, particularly in the case of where there's been an argument or we've been on different pages. And we need to think about, okay, what's it like for the other person, and cool things down when things get heated, and try and understand the people's perspective. So the thinking aspect is necessary, but the other aspect of feeling what another person is feeling, kind of feeling in your skin and being moved in your heart in the face of the suffering of your partner is key. And that's the more intimate aspect. Many people tell me that the person who survived the brain injury was their confidant, the person who knew them more than anyone else. And now they seem the farthest away after their injury. And, when the partner is in distress, they need the person who they used to have to manage to give them a cuddle, to be there for them and help them with that distress. But if it's that very person that no longer seems like the same person, or the connection between partners was different, then that distress can't be resolved, that can't be managed, that can't be reduced without some help. And I think these kind of things that I'm talking about here is another angle on the issue around personality change. One thing I came to realize that when people describe survivors as having a change in personality, when partners are describing that, they're saying at the same time that they're heartbroken. They're saying at the same time that they have someone who they don't recognize anymore, and that there's a gap between them, and they feel so alone with that. And then from the survivor's perspective, alongside that, survivors describe feeling confused, feeling like things keep going wrong, recognizing that there might be difficulties relating to recognizing other people's emotions, empathizing with other people, putting the brakes on things, having a short fuse so that people get angry and frustrated quickly. And that can cause harm and distress to the non-injured partner and can cause damage to the relationship. And these things keep going round and round and round as a bit of a negative cycle. And then I think what happens then is that the non-injured partner can only deal with heartbreak for so long. They can't keep trying with no help. And so eventually, even if two partners are living under the same roof and stay living under the same roof, the non-injured partner steps away and creates some distance just to manage their own heartbreak. And unfortunately for the survivor, that gets even more confusing because the survivor may need more overt cues to help them empathize and understand the needs of their partner. But the non-injured partner is now giving them fewer cues because they've withdrawn and stepped back. So there's been a lot of research on these patterns and these difficulties, and that's led to a lot of couples work that I do, that we aim to work live with the emotions between a couple, and where both partners want to try and reconnect after the injury, look at these negative cycles that happen between people. It could be one person pulling away, the other person feeling rejected. It could be both people trying to turn up the volume, and that's when kind of conflict and even violence can occur, or it could be more like a slow drift away from each other, like a tumbleweed moment where the distance rather insidiously gets wider and wider and wider. People get farther and farther away over time. So it can be very distressing, it can be very saddening, it can be very difficult. But I think that's been compounded by a lot of the majority of brain injury services not offering couple support. There are Headway has done a leaflet on relationships after brain injury, a information leaflet on brain injury for partners. There is the other leaflet on sexuality after brain injury, which we talked about in a previous webinar, along with dating from a single person's perspective. Today we're talking about where there is a couple relationship present. At a time, so it's not common for a brain injury service to offer couples therapy. Some clinical neuropsychologists are getting trained in this. It's my aim to train more clinical neuropsychologists with basic couples therapy skills over the next few years. So we're hoping to address that. On the other hand, couples and relationship counselors like Relate and services, they can be useful, but often they don't recognize the unique impact of brain injury on a survivor, their partner, the relationship, breakdown in empathy skills between couples. So it's kind of stuck between finding someone who understands the impact of brain injury and someone with skills in supporting communication and emotional connection between couples. So it's few and far between at the minute, but hopefully those opportunities will grow and develop around the country and around the world in the years to come. All right, so those are my ideas. I had some nice pictures as well to go with that, so apologies. What I will do, I'll send some pictures over to Fionn after, and yeah, she can send them round to you guys in the next few days. But probably it'd be nice to maybe just open up for some conversation. So I do want to make this specific to people in couples relationships or where a couple's relationship has ended after the brain injury. We're not going to talk today about single survivors looking to meet people and dating. We talked about that in the previous webinar. So if you're a survivor in a relationship, things aren't great, or if a relationship has ended since your injury, or if you're a relative, a partner, and have some perspectives, do feel free to start the conversation. So either unmute yourself, raise your hand, or put something in the chat, and hopefully Fionn can notice everything and orchestrate it all. Fire away, over to you guys.
We have Sue who's got her hand up. Sue, would you like to ask a question?
Yeah, I think one of the aspects of rehabilitation is that it's a period of adjustment, and you're encouraged to.
That's not what I wanted. Sorry? That's gone. Sorry, Sue. Are you still there?
I am. Shall I try again?
Yes, please.
Yeah, just trying to say, I guess that one of the aspects of rehabilitation over the years is to try and adjust and change yourself as a person. But that sometimes that process of change, of becoming what I think Headway quite often refers to as the new you, if you are within a relationship and that continues, that potentially can be a bit problematic. And I just wondered, Giles, if you had any thoughts on that, and how when one person is actually being actively encouraged to change and adjust, how that can be included within a relationship. I don't know if that makes sense.
Yeah, that's a really good question, Sue, and nice to see you again. Thank you for that. I think there's a couple of angles to that. So first of all, because brain injury services are focused on the survivor, there may not be an opportunity for the partner to be part of that journey, to be invited into those conversations. So just by dint of the brain injury services being kind of focused on individuals and not couples, then partners can be left behind to that journey because they're not invited. Of course, a survivor has a right to their own unique conversation and their own support, as do partners have a right, actually. We used to have, when relatives groups and partners would be able to talk to other partners and talk about things in a very kind of confidential way without fear of hurting the survivor. But often couples aren't given the choices how they like to have that conversation. So that's the first bit. Then in that journey, you're right, people can undergo very profound changes. And some of those changes can support a couple's relationship, and some of those changes can erode a couple's relationship. If it was built on something that was there before, that's no longer there now. Post-injury is different. So one couple that comes to mind is a stroke survivor who was very, very assertive, and his wife really valued his assertion before his injury. They're quite a traditional couple, and he was like the public facing aspect of the family, and she was quite nervous, and she felt kind of shelter in his confidence. And after his stroke, he was a bit more passive, initiated less, and was a bit less confident, and actually moved towards a kind of softer, more introverted kind of direction in life. And that's when he lost his wife. His wife couldn't manage that. She lost her outward, outgoing, confident husband, and it just wasn't her husband anymore, and she couldn't adjust to that. And so that's when they decided, and she led that, decided to separate at that point. So that's one example of how someone's journey, both the impact of the injury on who they were as a person, but changes in life priorities, had an impact on the couple's relationship. To contrast that, a lot of the couples work that I do, I'm thinking of the male survivors. The men often undergo an amazing journey to be better lovers in the emotional sense I'm talking about, more open partners than they ever were before their injury, by acknowledging their vulnerability. The brain injury kind of forced their hand, whereby they couldn't just be the person who accomplished everything at work and all aspects of life anymore. And they actually had to turn to their partner and ask for help. And that actually opened up a new dialogue. Instead of assuming what their partner wanted, because before they thought they were amazing at everything, they had to go from a position of vulnerability, reach out from a position of confusion and say, I don't know what you need, can you help me? Or I'm scared, can you help me? And let their partner in through a position of vulnerability in a way that never happened before the brain injury. And a lot of the male survivors, that's what have become better listeners by not assuming they knew, and reaching out and asking and clarifying more, and having a kind of a greater focus and care and consideration for their partners once they were supported to do so. To return to the original point, often the couples work that I do requires the non-injured partner to do things differently too. Requires a non-injured partner to initiate, to reach out and say, I need you to do this for me. This is why I'm hurting. This is what I need from you. And that puts the non-injured partner in a really vulnerable position. They're kind of suddenly stepping out from the shadows and risking, this is what I need for you, this is what I need from you. And the survivor could say, no, or I don't care, or can't do that. And so that's really vulnerable. And for some non-injured partners, that's too big a step, maybe because of lots of difficult early experiences and things like that. So I think, yeah, the adjustment, changes in identity is a process that happens for survivors, but for partners too. Couples often talk to me about two-way personality change, where the non-injured partner feels different, how the couple are together feels different. And that can be too much for many couples. You know, it could be in the acute phase of the brain injury to go from lovers pre-injury to physical carers and toileters. That's a huge gulf to come back to equal lovers months or years later. So that could be like a deal breaker, and that can't be hard to come back from. And then conversely, I've supported survivors who have separated or finished with their pre-injury partner and have found a new partner where that person works for their new post-injury self and identity. So all of this is about kind of continuity and connection between people and seeing if that's possible to re-establish, or if not, and it has to be both people invested in trying to make things work and finding a way to move on in a way that minimizes hurt and heartbreak. So that's a very long question, Sue, but that was a very deep, very long answer to your very deep question. Maybe we can pick up some aspects of that in the subsequent discussion today.
Has anyone else any questions? Please put your hands up or chat or type into the chat function. No, nobody with any questions. Linda, thank you. Would you like to unmute yourself, or would you rather put in chat?
No, I didn't know how to raise my hand, so I thought how to raise my hand there.
Oh, thank you, Linda.
I've got an unusual situation in that my husband is the person with the brain injury and has had the brain injury for 37 years. I met him post-brain injury, so he had it when he was 17, he's now 54. But originally, straight after the brain injury back in 1984, there was no rehabilitation as such for him. He had an extradural hematoma, it was a slow bleed on the brain. He was, in hospital for, I think, 10 days. 3 of those initially, they hadn't recognised that there was a bleed on the brain, and then he started to deteriorate and got the operation. And then post that, he was back he was back sitting exams, final exams, a few weeks later, within 6 weeks. He was then in the August off to university. So, pretty much after his hair grew back, the world kind of thought everything was back to normal and treated him as such. And I came to the relationship knowing that he'd had a brain injury, but not, obviously at that time, not really recognising and not having any awareness of what that actually meant in terms of long-term difficulties. And what I would say is, as a result of not having, the support early on, is that he struggled. He's had breakdown after breakdown within the first 10 years. I think it was around 9 years after the brain injury, his first mental breakdown. But everything from then on was pointed at it was mental health, and nobody ever recognised it as being related to the brain injury until just this year. He's actually had his first neuropsych assessment and recognised, you know, that there are definite difficulties. And he's always, I don't know if others who either have a brain injury on the call or a relationship with someone will, you know, hear them talking about not being themselves, not being the person that they were pre-brain injury, feeling like somebody else, or feeling like they're looking at themselves, but not actually feeling like themselves. So he went through, you know, life really feeling like that after the brain injury. But our difficulties, you know, have been long-standing, and I think it was probably 4 years ago we had the first psychologist who had experience with people with brain injuries, who had acknowledged that there were definitely difficulties with the brain injury there, but it's taken till this year for us to actually get the proper neuropsych assessment. And I think the difficulties that I am now experiencing in the relationship is that there's been a lot of challenges right throughout our relationship with with mental health, with the depression, with anxiety, real anxiety, with all of the brain injury difficulties that Michael's been trying to express he has, that's never really been believed or appreciated as, you know, being related to the brain injury. So, you know, when his personality, or when he has emotional dysregulation or emotional lability, which, you know, he can be triggered very easily, and you know, that leads to perseveration and different things like that. I'm finding it very difficult after all this time of being in a relationship to actually know how to act and how to support him through this. Sorry.
That's okay. It must be really, really difficult. And thank you so much for sharing that.
I was just going to say, or ask, you know, that there's an expectation. I know that there has to be an expectation on me modifying my attitude and modifying how I approach our relationship and how I approach some of the difficulties that he has. But it's really to find out, you know, I'm in Scotland, and I know that there's obviously a different health system in Scotland, but if you have any idea of where I can go to get some support around this.
Yeah, thank you, Linda. Whereabouts are you in Scotland?
I'm in Aberfoyle, which is kind of in Stirlingshire.
Mm-hmm. And did the psychologists who do the neuropsych, did they offer any kind of support after the assessment?
No, so we're just waiting for the report to be written up. So she actually included me in 3 sessions in the process. So there's 2 sessions where I attended with Michael, and 1 session where it was just her and myself on our own. And I found that very, very helpful, because I was able to, you know, to talk to her and really understand some of the things that she had identified that Michael has difficulties with, that, you know, we could talk about it in the context of how that, you know, how that actually appears in real life kind of thing, or, you know, not part of the assessment, but taking it into the context of everyday life.
Yeah. So,
you know, I don't know whether when we get the report back, there'll be an opportunity to discuss, you know, but it's something that I'm aware of. You know, I have asked from the NHS before, I have asked for support, and even Michael hasn't had support from the NHS around this. The psychologist that we're seeing is a private psychologist, and we had to fight and go to an MP or an MSP to actually get him, you know, to have the neuropsych assessment. So it's just been, you
know, No, thank you for doing. And it's it's not. I've met other couples in similar situations where it's been a brain injury has been like a third person in the relationship for many years, and there hasn't been recognition. And I think the unique face of a brain injury in a couple's relationship is still a kind of marginalized aspect of brain injury that's not talked about, let alone services exist to support. Sounds like the psychologist you're working with does have an awareness of the impact on couples, because they've included use, but I'm hopeful, that maybe if you raise with them the most difficult moments and what they look like, the neuropsych assessment will inform what factors may be leading to that, and how you and your husband can manage this. Because what this brings up too is sometimes partners are, I'm not saying this is the case for you, Linda, but in other services, some partners are viewed as rehabilitation assistants, and with the focus on the survivor, recommendations are given for partners to follow to help the survivor, whereas the distress and the devastation and the heartbreak and the impact and the needs of the partner is not taken on board and is not seen. So where in the last 15 years or so, the survivor and the partner have always been the joint client, the joint patient for me, and both those needs are held side by side. So I would say, as part of the assessment process and this psychologist getting involved, make sure they know what your needs are and what happens for both of you in a difficult moment. And both sides of those challenging, difficult moments are communicated across the psychologist, and the results and the data from the assessments may be helpful in unpicking what contributes towards that. But that I just wanted to say, something that it did raise, that last point raised, connect. We did a previous webinar on returning to work after brain injury, and I just wanted to say, well, it's in my mind, sorry, that some survivors are focused exclusively on returning to work, and for some people, they can return to work and be functioning during work hours, say especially if they're trying to return to full-time work, but they come home and they're a shell of a person because of fatigue, being overwhelmed by the feat of managing work throughout the day. So work colleagues get to see the best of the survivor, and partners get to see a drained, irritated, frazzled version. And that's often a big kind of life priorities question that I go through with couples. Yes, you might be to pull off return to work, but is that the most important thing? It may be fundamentally because of like income and things like that. But for those reasons, some people choose not to return to full-time work. So there's a bit of them left for their family or their partner. So that just made me think about that, about priorities, because some aspect, fatigue is a big impact on couples' relationships too. And what is happening for both partners across the week, that's either eroding away, taking away resources for them as a couple, versus how can some couples' time be reclaimed at a key point in the week. I'll give you a little example here. I work with a couple following a stroke, and the guy's stroke, the couple called the stroke Chucky. Chucky, the little demon doll from the 80s horror films, because Chucky would kind of sneak up when no one was looking out of the shadows and cause a fight. And Chucky was most powerful in the kitchen when the survivor would get kind of overwhelmed by noise in the kitchen. He needed the kitchen to be very tidy to process information. And when his partner left it in a mess, he would get very angry. So they'd have all their arguments in the kitchen. So that was like Chucky's domain. He was the most powerful in the kitchen. Whereas in their living room on a Friday night, they could still put on some music, get a takeaway, and relax. be close, have that little ritual that they had as a couple before the stroke. And it was like Chucky would never go away. They could never get rid of the stroke, Chucky. But they had Chucky on like one of those extendable dog leads, so they could shut him in the kitchen and have each other as a couple on a Friday night in the front room. So it made me think of that too. Your tune with the Klingon, that is awesome. Yes. I very much encourage couples to externalize, give the brain injury a name, because the brain injury wasn't asked for in most cases, right? And both survivors and partners do need something to blame, because this thing happened and changed everything. Blame is necessary. And if the brain injury is something that it happens to be in one person's head, but it's an entity that affects both partners, then maybe the two partners can collaborate and get around to do something sneaky against the brain injury. Another couple I work with called his subarachnoid hemorrhage at the lodger. So like a lodger that they couldn't evict. When the hemorrhage happened in his head, it was like he opened the front door and the lodger came in. But now, in their life as a couple, the lodger is running rampant, running round, and they can't evict him. So it's their shared problem. So what are they going to do about this dodgy lodger that they've got? So that's another nice framing. But yes, names for the brain injury that the couple can describe is a good thing, because it stops blaming the survivor. Because in most cases, the survivor didn't ask for this either, but it allows the couples to try to collaborate and team up against the brain injury.
We have a question on the chat from Gail. I'll just read it out. Apologies for texting rather than talking, but I can't speak right now. Are there any tips for how to maintain the balance between supporting the survivor on their journey to recovery, but not slipping into constant giver or taker relationship? For example, how can you work to maintain your equal status in a way that isn't too conflict orientated? My husband has PTSD following a cycling accident in 2017. He is struggling with hypervigilance, which is spreading to the household, who don't want to trigger him. But I worry it's become the norm for him. He can't remember being any other way, and really need to address it, as it's an exhausting and stressful environment to live in. I would like to gently encourage him to see the impact this has on others, as he's very much stayed in that survival mode of me first since the accident. I don't think it's conscious. Thank you, Lynn. Thank you, Gail.
Yeah, thank you, Gail. It's a big issue, isn't it? That's so the general point you raised first of how do you get towards some equality in a relationship? It's difficult, isn't it? Because if we're talking about equality, there is the Equality Act and the issue of what's a reasonable adjustment to help someone with a disability have as equal a chance at any aspect of life as anything else. And so things may need to be done differently to allow both partners a fair chance at coexisting with each other. But from what I said before, you should not be automatically expected to be the carer and to put your own needs aside forevermore, because that just simply won't work. It'll, even with the best intentions, it's not a viable solution. So the couples I work with who have found the position of harmony and equality have been very clear in saying, this is what I need from you, and this is what we will do when difficult moments happen, and we'll do this, and we know that we're doing this out of respect for each other. So it's a bit of a long game, but it's definitely not achieved through one person sacrificing their own needs. It's about being clear and negotiating. And that's a hard process to say, actually, say emotionally, this is what I really need in these moments, and to see if that's possible, because every human being needs to be loved and thought about and respected. And someone with a disability needs that, but may need things to be done differently. So they have a chance of doing that for the other person. So it's a complicated old business. Then you mentioned PTSD. I think that's an additional one that does make things even more complicated. There's been couples therapy that's been developed for PTSD survivors without brain injury, because PTSD itself is such an eroding, such a challenging aspect onto couples relationships. So in fact, one of this couples therapist, Sue Johnson, talks about PTSD as a dragon that snaps at both partners, and when the sufferer of PTSD doesn't feel safe, they withdraw and pull away, and that has a huge negative impact on the other people in the family. Conversely, when going through a couples therapy process, other members of the family can be a source. Members of the family can be a source of safety for each other. And Sue Johnson herself says, actually, rather than a therapist for someone with PTSD is really, really important. But when a couple works on it together, the partner, a therapist can be like a light bulb, but a partner can be like a floodlit stadium in terms of potential source of safety. But then a source of safety and emotional containment for each other. But PTSD isn't something that just sorts itself out. So I do hope your partner, your husband, is able to access help for that. And in the case of brain injury, it's teasing out what is PTSD, what is post-brain injury issues that look similar, how do they interact? That does sound like it does require some specialist input from a clinical neuropsychologist. But thank you for bringing that up. So the long answer is very complicated. The short answer is both partners need their needs met and communicated and acknowledged, and need to be aware of each other. But the route to that can require a lot of support from a professional. Justine's got a hand up.
Yes, thank you. Thanks, Justine. Would you like to unmute yourself?
Hi, I'm sort of asking from more of a professional point of view rather than sort of being in the situation myself. I work in a neuropsych department as a rehab assistant, and 3 years ago qualified as a counsellor. I'm counselling, I'm doing carer support counselling through Headway Lincolnshire, but the couples stuff is a real interest of mine. Although I've done a very short couples course, I'm just wondering if there's anywhere where you would could advise me to go to get some either more training or more knowledge. Because what I'm picking up on is that when I did the very short couples course, it was very much obviously about the boundaries, but that conflict of interest of one therapist seeing both people separately, and whether that does come into play with it, the brain injury involved as well.
Yeah, it does. It's a very dedicated kind of area of professional development. For the sake of the webinar here, what I'll say to you is if everyone checks out my website, and that's www.ripplingminds.com. For survivors and partners, there will be pages of resources for survivors and partners. That includes videos that I've done, the Headway leaflets, links to the Headway sites on supporting couples relationships. for yourself, Justine, or any other professionals, you'll find resources and training for professionals.
Okay.
You'll also find my email. You can get in touch and I'll tell you where to do the formal training courses in the UK as well, because there is a method that we found that is really good, and you can do a clear training route. So if you follow with that, ripplingminds.com, get in touch and I'll show you where to get thanks, Fionn. And then send me an email, I'll tell you how to get trained in something that will be quite useful for you. Okay.
Yeah, great, thank you.
Welcome.
Right, we have a question on chat from, if I can find it now, from M. As a couple, we both suffered brain injuries in an accident. We don't know how to deal with this. Can you please advise us on where or who we can get help from? Thank you.
Thank you for that, Em. Yeah, it's I've supported a few couples where both partners have had a brain injury. Once from both being in the same accident, and once when the couple met in a brain injury group as survivors. And of course, that's a really particular example of how you'll both have unique needs that both need to be met and respected and supported by the other person. And that requires even more careful consideration, doesn't it? I suppose what goes for you is that you both can understand what it's like to be a brain injury survivor. So you know what it's like in difficult moments. What goes against you is that maybe both of your brain injuries are different, or at the time when you really need that support, so does the other person. They really need that support at the same time. And in the couples where I've worked with where there's two brain injuries or a brain injury and another health condition, it's like four people in the relationship, the two partners and the two health conditions or the two brain injuries. And so it's kind of can be even more difficult. So I would say the same thing as everything else, really. Look for local, see if there's anything in local brain injury services. I would say, even given the caveat about people from Relate, for example, not being equipped to deal with brain injury, that may be a starting point, but maybe in working collaboratively between a local brain injury service and Relate, or some Relate therapists are very willing to skill themselves up and understand about brain injury. So maybe finding a local, if there's no brain injury couple support, finding a local Relate service, looking at sources of information like the leaflets from Headway. I've done some videos. There's our session now, but I've also done some videos for other brain injury charities, Different Strokes, Same You on this. You can have a look around. If you check out my website, you'll see the details. But I guess it all depends on local availability. I know a lot of services are offered online, but this is the one thing that I don't offer online. I don't do couples work online because I don't think it works. Like only face-to-face couples work works for the way I work with couples. It needs that emotional intensity of a therapist being in the room, and that may be even harder to access in current kind of COVID times. But as a starting point, seeing who's about, just going to a couples therapist, Relate therapist, and saying, this is our situation, and it might be a starting point. It might work out for you. It might help you both have a space of listening to each other and your needs and taking it from there. Or conversely, trying a brain injury community service if there's one available to you, seeing if perhaps, generally it's the clinical neuropsychologists and or speech and language therapists have a more of a focus on supporting couples. So there's some options for you there, but it's few and far between. I do appreciate that. Right,
I think there's another question. Do all this find? Right, I'm just reading it through now from Linda. Do others find that communication is greatly affected? For instance, my husband has difficulty with processing speed, and so if I ask him a multiple choice question, this alone can be a trigger, especially if I then go on and suggest a response because he's not answered as quickly as I would have. Clearly, having done this and many other things for all these years, he feels that the way I communicate with him is exhausting and leads to fatigue. Just wondering if others have similar issues. Thanks, Linda.
That's a great one, Linda. I'll let other people respond to you first before I share my views, because it's great to open that out to other people. Sorry, I'm just chewing an apple while I'm waiting. I imagine other people. Oh, there we go. Gail says definitely a lot of agreement. So that's one reason actually why I chose the approach to couples therapy that I do. It's called emotionally focused couples therapy. And the way I work in its sessions is by slowing things down. It almost like gets quite hypnotic. We break things down into a singular focus, and we slow down. We focus on the emotions in the room. We focus on imagery, and we communicate one piece at a time, and we get out of our heads and into our hearts. And by slowing everything down, time stops, and it's just the couple and their vulnerabilities and their needs. And in that space, in that tempo, those needs are more likely to be seen. So yes, negative emotions like anxiety and anger are fast, whereas love and tenderness and empathy are slow. So switching and slowing things down is something that every couple would benefit from. And this couples therapy is a way of getting into that changing speed so that things aren't too fast, which is handy for brain injury survivors. It doesn't overwhelm, and it's more likely to tune both partners into the tenderness channel, which is at a lower speed than the overthinking, demanding channel, which is at a faster speed.
So, just looking at the chat now, it's a lot of agreement. Thanked for your reply to her question. Gail added that he doesn't like to be interrupted, but it's really hard to tell when he's still thinking about something or has switched off. Then Evelyn says we suffer the same difficulties. And I'm just going down. Yeah, a lot of comments just agreeing. And then Linda added, my husband is exactly the same and his speech is very gappy, and so I think he is finished speaking and I end up interrupting. Oh, right, we've got Sue has raised a hand. Would you like to unmute yourself, Sue?
Yeah, sorry, I can't type and listen at the same time. Just to reply to that, and obviously sometimes admitting these things about ourselves as someone with a brain injury can be hard. I have really slow speed of processing, so I'm fine for a while with a conversation, but then very quickly that can fast become unbearable, and I might only have a few minutes where I've been fine listening to somebody talking to me, And then within that space of a short period of time, it gets so unbearably painful in my head. The way I try and explain it to people is that, imagine if you've picked up a box and you're standing holding on to it, and for a while it's okay. But if you have to hold on to that box for too long, your arms start to tremble. And if you can't put it down, it can really quickly get really painful. And that's sometimes what conversation feels like. So at that point, when I've reached that tipping point and it's getting painful, is also when I'm least capable of being sensitive and articulate. And so sometimes I just sort of bark out, I need quiet. And that, for the person on the receiving end, for the person who's talking, is really hard, because that's effectively turning around to somebody and almost saying, shut up, I can't bear you talking anymore, which isn't what I'm wanting to say. I'm trying to say, my brain really hurts, but the bit that comes out is be quiet. And that's difficult from both people's perspective. I don't really know. There's probably better ways of managing it than that I've not quite got there. So I really do understand, Gail, where you're coming from. And I guess just from that other perspective, from the person with the brain injury, my intent isn't to cause harm or to hurt or upset someone. It's just that sometimes the pain in my head is so unbearable. I don't have capacity to be polite.
Yeah, thank you. And as someone else mentioned on the chat, that's a great analogy about the box. It's wonderful. It is really difficult, and there are different forms of reaching out, aren't there? Sometimes reaching out with words has the opposite effect, pushes people away. Sometimes people need a hug and no words, just need to be held. Other times that's too much for some people because of touch sensitivity. And when people get overwhelmed, that kind of threat response comes out, which can be too much, go away, and that can leave the non-injured partner feel rejected. So it's really difficult to think about what happens in negative cycles and interactions between people. Is it too fast? Is there too much words? Is there too much exchange between people? Does it need to be slowed down? Does it need to be, do important conversations need to be had at a particular time of day, maybe in the morning, not in the evening? Are there things that kind of need to be put down on paper or emailed and passed over, and then, not in the heat of the moment? Really difficult. Interestingly, the couples therapy that was first used in a brain injury setting was done in Ottawa, in Canada, for stroke survivors with aphasia. So the first time it was used with people who had very little expressive language post-stroke, and they were focusing on ways to connect emotionally where words were not available. So it requires a bit of kind of careful support with someone to help you both, because the brain injury can be a bit of a bully and try and divide and rule, divide you both, and be the kind of secret victor in the background. What I do as a couples therapist is to say, actually, you outnumber the brain injury, and with me by your side, that's 3 of us against the brain injury. Let's flush it out into the open. Let's not let it do this to you both, and find out a way of doing that. But that's a unique journey for each person. I'm aware of time. We've hit the hour. Maybe got time for 1 or 2 more questions or comments.
Yes, we have a couple of questions in the chat. Suzanne is asking, how do couples access your type of services 10 years after brain injury when no longer under a consultant?
Yeah, it all depends where you are. Some of my colleagues do couples work online. So they might be able to see you wherever you are in the country, although it be privately, so there'll be probably a cost with that. You might be lucky that the brain injury, if there's a community service, then you could be referred back into it if there was any couple support in there, but it really much depends where you are. I would say as a starting point, check out all the information sources and talk about it with you and your partner together. Read the Headway leaflet on relationships, look at some of the other videos, and see where it takes you going forward. And if you have some specific questions, you can always drop me an email. If you go to my website, you get my email from the website, and then I'll see if I can help point you in the right direction.
Thanks, Giles. Linda's made a suggestion on the chat. I would be happy to share my email address with anyone who would like to connect separately after this, and we can maybe create our own support group. Let me know and I will message you privately.
That sounds awesome.
Yeah, so if anybody's interested, please give Linda a message. So just looking to the end now. Thanks everyone. So a lot of comments about thank you and how positive this session has been.
Good.
So yeah, that's all the questions.
Has Sue put her hand up again, Sue, or was it the original hand up?
Sorry, that was the original hand. I haven't clicked the taking my hand down.
No worries, just checking. No worries. All right, guys. Well, thank you so much. And obviously, this is it's a really difficult. So just like the one when we had on sexuality, it's difficult to come up kind of and say like, this is what's going on for me or for us as a couple. And I think the sharing that you've all done from the perspective of survivors, partners and professionals you've had in this session has been really important, because it just allows this kind of marginalized conversation to be out in the open. I just want to finish with the question. When I teach psychologists, my aim is to teach neuropsychologists to have better couples therapy skills over the years to come. But I start with the question was, dare we try and rehabilitate love? It's quite a weird thing to say in rehabilitation, all the things you can rehabilitate. Why can't we try and rehabilitate love? Because love is something we hold as a key aspect of our society, isn't it? Love songs, poetry, all these things. So why shouldn't it be a priority of rehabilitation? So in the end, hopefully, that will be a focus of rehabilitation or subsequent services as much as independent living or anything like that, or individual support. So, but in the meantime, I think having conversations like this help people feel less alone, because part of all of this distress is being alone and rejected, saying like, you're not alone dealing with this. Here's some information, take it step at a time and see where we can go from there. So thank you for all of your input, guys.
And I'd really like to thank you as well, Giles, for joining us and giving us this excellent session.